Welcome back, everybody, to the OPT Network. We're switching gears just a little bit, and we're talking about open enrollment for low-income households, Medicaid, the pink envelope, and everything that you need to know and understand, especially post-COVID. Our guest this morning is Julia Watson. She's a certified Health Insurance Navigator for Central Louisiana AHEC, that's Area Health Education Center, and she joins us to talk about what we need to know and understand going forward. Julia, good morning and welcome.
Good morning. Thank you for having me here.
Absolutely. So a lot happened during COVID and after COVID. And so now we're talking about Medicaid and what people need to know. It's really unwinding. So they hadn't checked people's criteria or their status, but now they're about to start again.
Yes, that's correct. For the past 2 years, a lot of people haven't had to renew their coverage through Medicaid due to the public health emergency or the COVID-19 pandemic. But now, since everything is kind of opening back up and then things are starting to get back to, I guess,
as normal as we can.
So the Office of Medicaid is expected to basically review everyone who is enrolled in Medicaid to see if they're still eligible to receive Medicaid.
And for a lot of people, that might be scary because a lot of things changed during the pandemic with people's income. So what do people need to know?
Basically, one of the things that we've been trying to promote is if you had any recent changes, such as your address, your telephone number, contact information, increase in income, things like that, you want to report it to Medicaid. So you could either contact Medicaid or you can contact us. We provide assistance to help those who might have had those changes to update their information so they won't possibly be disenrolled from Medicaid.
So what about people's incomes who changed and went up?
For those who've had a recent change in income and it's put them over the maximum income limit, the gross income limit for Medicaid, they do have what they call special enrollment period. So if someone is over their income limit for their household size, and they're denied Medicaid, they could see possibly applying for a special enrollment period through the marketplace, which is ran by the federal government. And we provide free assistance to help them apply to see if they're eligible for that.
So in other words, if their income changed, they may no longer be eligible for Medicaid.
Yes.
And they're going to have to look at the marketplace.
Yes.
So just in all fairness and truth, a lot of people that did have increases may not want to report them. What do you say to those people?
I would tell them either way they would have to report it either, because if they don't report it, chances are they still might be denied, because what Medicaid will do is they will send out a renewal notice to let them know, hey, you're up for renewal. And one of the things that they might check is the income. And if they need verification of their income and they send their letter out to that person to let them know, hey, it's time for you to report changes to your income. And if your income is over the limit, but you don't report it, you'll still be denied Medicaid.
And so for people who are not familiar with Central Louisiana AHEC, Area Health Education Center, tell us some of the things that you all do to help people's lives work a little bit easier.
Well, we have many programs. Most of our programs are geared towards high school students who are interested in the medical field. We also recently started a program for junior high students who might be interested in a career in the medical field. We mainly are tailored towards underserved populations or populations that don't really have too many medical professionals. So that's mainly what we try to focus our, attention towards.
Okay. And so for the special enrollment period for low-income households, what does that look and feel like for people who need to get enrolled?
So if you are a person that has low income and you might not meet the criteria for Medicaid, the special enrollment period does have options where a person, once they apply, they can qualify for what they call advanced premium tax credits, which helps to lower the amount that a person will pay for a monthly premium. And this year, they recently introduced a specific special enrollment period, which is geared towards anyone who makes at least 150% of the federal poverty income limit. And if your income falls within that range, your monthly premium would likely be $0 per month, which is extremely, helpful for those who might be transitioning from Medicaid to the marketplace.
And so what is that? Do you know just right offhand what that income range is?
It's a little bit over the gross income for a person, a household that has Medicaid. So it's maybe like $1,000 to $2,000
above.
Yes, ma'am. Yep.
Okay, and so how can people come in to Central Louisiana AHEC and sit down and get the help that they need to find out what they qualify for and what that will look like in terms of if they're no longer eligible for Medicaid?
They can contact us at our office, our local office. Our phone number is 318-443-2855. To set up an appointment, if they just want to ask questions, they can also do that. Like I say, it's free assistance to anyone who might be interested in seeing their options besides Medicaid as well.
Now, is there a move, Julia, to move people away from Medicaid, or is this just simply a check?
It's just simply a check. For the past 2 years, it really hasn't affected nearly as many people. And the reason why is because Medicaid had an agreement with the federal government. So basically, the federal government promised to pay a certain percentage for Medicaid expenditures in exchange that they wouldn't disenroll anyone from Medicaid. So a lot of people who are on Medicaid and probably shouldn't be on Medicaid are probably going to be affected by this. So.
Right. And so tell us about the pink envelope.
The pink envelope is one of the ways that Medicaid will try to contact a person who has Medicaid. That's the first method they'll try to do, to reach out to someone to say, hey, we're trying to make sure all your contact information is up to date. So that person will receive that letter through the mail. Chances are it could come from one of their managed care plans, which is through Medicaid. It's 5 different plans that Medicaid has. So chances are they will receive that from their managed care plan. And it's just to make sure that they have their information up to date.
Right, because they're now taking a look at everybody that's on Medicaid where they hadn't done that in the past 2 years because of COVID.
Right.
And so moving forward, the effective date for Medicaid unwinding is going to be October.
Yes, they are targeted for October, mid-October, due to the extension being July 15th of this year. What the current administration has promised is to send all states a 60-day notice to let them know that the public health emergency is set to expire. And that would have happened in May. But since they didn't receive it in May, chances are they're going to extend it, and it's going to be extended to October. Absolutely.
And before we've got to let you go, Julia, just tell people how they can connect so that they can maybe even qualify for marketplace insurance. They won't be out of insurance if indeed they're, because this really is contingent upon the income, isn't it?
Yes, yes. Yes, ma'am.
Okay, so how can people connect again with Central Louisiana AHEC?
They can give us a call at our office. Our office is located at 1308 Dorchester Drive here in Alexandria. The telephone number is 318-443-2855.
Right. Some specialists will sit and go through the process if people are really concerned about whether their status is going to change.
Yes.
Julia, thank you so much. Thank you for all that you and Central Louisiana AHEC are doing to be agents of change in our community.
Thank you.
Indeed. Hey, everybody, stay on point. We're back right after this.